I'm here today with my good friend Marcus Whitney. We are working on a partnership for Health Further Festival in August of this year in Nashville, Tennessee. Health Further is a health-focused festival that is held every year and attracts thousands of people. And we're going to be talking today about what Health Further means and why it's important and what people are going to see when they come to Nashville. So Marcus, tell me a little bit about Health Further. How did it become a project for you, and where do you see it going from here?
Sure. So my other job is I'm a partner in an early stage venture fund called Jumpstart Foundry, and we've been doing Jumpstart it was going on our 8th year.
Right.
And in 2015, where we really started to dig in on the healthcare space specifically, we realized that investing in companies wasn't quite enough. We needed to have a deeper understanding of the industry.
Okay.
And also being in Nashville, which is such a strong cluster for healthcare providers, we had a sense that we could also help that segment of the industry to understand more about the innovation that was happening all around the country.
Okay, so what's the format? How are we gonna? What do people, if they come to Nashville?
Yeah.
What can they expect to see in the 4 days, August 21st to 25th, at the Music City Center? What can they expect?
Yeah. So we've structured the festival to be a journey. So we start, I would say, with maybe the most disruptive, inspiring thinking in a consumer summit that'll be held at the Country Music Hall of Fame, CMA Theater.
Okay.
And that's going to have voices and leaders from the consumer industry, which is now starting to get more and more engaged in the healthcare industry. And they're going to be talking about, how they would apply the lessons that they've learned or the tricks that they use in the consumer world to the healthcare industry if they were a healthcare company.
Okay, so let's dig into that a little bit, and we can go day 1
Sure,
through 5,
sure.
one at a time. Day 1 through 4, I mean. So we're going to talk about consumerism in healthcare. Let's say Amazon recently announced, or didn't announce, but is rumored to be looking at disrupting the pharmacy business, which, if there's a business that needs disruption, it's probably the pharmaceutical industry. But talk a little bit about how these companies, because none of them are actually in the healthcare space,
That's
right?
correct,
So talk a little bit about the kinds of questions that we're going to be asking them, or the kinds of things they're going to be talking about, because this is not what people expect when they come to a healthcare conference. They don't expect, to see Amazon there necessarily, although they probably should, right?
Well, I think the status quo and the way that the industry has been for at least the last 50 years, but really even longer than that, it has always been about payers and providers.
Which happens to coincide with the government getting involved.
Exactly. It's always been about payers and providers, right? And then we as patients are just sort of the subjects of their business transaction, right? And
nice feeling that.
Yeah, and that's changing. I mean, it's not just sort of hype. It's real, measurable household income shifting. I mean, expenses shifting in the direction of healthcare, to the detriment of other things like investing and education and things of that nature. So with that, I think consumer companies like Amazon that are incredible at providing high levels of service and engaging and sort of predicting customer needs can especially fulfill those needs in healthcare that are less clinical in nature, and pharmacy is sort of a really great example of one.
Okay, so I think we talked earlier today about like a Facebook or a Pandora. What kinds of things will they talk about in as it relates to healthcare? Because I'm having trouble seeing. I see the connection with Amazon really clearly, but how to draw the lines from those two things?
Yeah, so I think, first of all, I think the shift for the healthcare industry becoming consumer is still very early. And so our perspective is not to say, hey, these companies are coming at your healthcare industry, you need to sort of watch out for their new services, right?
Right.
But it's more to say the healthcare industry really doesn't know how to treat the patient like a customer.
That much is clear, yes.
Right? And so we want to have a day that is focused on customers, right, that are not big businesses that are insurance companies, but customers that are actually your patients, and just sort of shifting that perspective and teaching them through the leadership of these, icons in the consumer industry what are the best practices there and how they need to shift their perspective.
Okay, so a company, and then we talked about a design company like a Tesla or a Apple or something like that. What do they bring to the conversation? Because they're known for, obviously Tesla's very early in its development. It's not, I think their customer service is pretty good, but they're mostly known for design, right?
Yes.
What do they bring to the conversation there?
I mean, if nothing else, just the value of design and aesthetic in the consumer experience, right?
Right.
and the fact that it really does make a difference in customer satisfaction when things are beautiful.
Right. We don't see that much in healthcare.
Not that much. We are seeing some emerging examples, right? There are some leaders in the space now, really sort of on the fringes. Some early stage companies that are
like what? Give me an example of that.
There's a new one that came out in San Francisco. I think there's a series of companies right now that are, whether they're in the insurance space or the clinic space or sort of the behavior management space, are all focused on design. Omada Health is a company that...
Omada Health?
Yeah, Omada Health. They're
Okay.
a company that is focused on diabetes management.
Okay.
And they do it through community, and they do it through a scale and beautiful applications. I mean, and the design is like, it's just beautiful, right?
Well, and Apple, after making those stupid, clunky little PCs, it went right into design and can I think attribute a lot of their success to just making a really beautiful product.
Yes.
A computer that you actually want to have sitting.
That's right.
Sitting on your desk. All right. Well, so let's go to day 2 and 3.
Okay.
The HIMSS Summit of the Southeast.
Yep.
So HIMSS is a national organization. Andrew Friedman from the healthcare team and I were at the conference in Orlando earlier in the year, and they have a huge event in Nashville because we have such a healthcare community.
That's right.
So this year we're going to move that all. It's going to be folded into the Health Further.
Yes.
And how will that be different from day 1? What can we expect there?
Yeah. So days 2 and 3. First of all, we're really excited to be partnered with the Tennessee chapter of HIMSS.
Oh, they're great. Yeah.
Tennessee is such a big state when it comes to healthcare. In Memphis, you've got sort of all the bio and life sciences.
Yeah.
And then
and
you've
Meditech,
got
yeah.
Yeah, exactly. And obviously Nashville, and then in East Tennessee you've got Oak Ridge, and so there's a good balance of incredible things happening in healthcare technology across the state, and so to be able to partner with them and bring the Summit of the Southeast to the Health Further Festival is great. We're actually going to have 3 stages going on simultaneously. So Tennessee HIMSS and Summit of the Southeast will be one of those stages, and we have 2 other stages that we're going to have going on in the Music City Center exhibit hall. One will be about wellness, and so this is where we're going to touch on all things food, mental health, the built environment, the power of art, the power of music. All of these sort of emerging modalities that we're realizing contribute to our health, beyond just sort of acute care.
I think since the day 1, you're bringing in companies that aren't in the healthcare space, but have something to contribute to how healthcare could change and how it will have to change.
Yes.
You no longer have a $500 deductible; you've got a $5,000 deductible.
That's right.
You think about it a lot differently.
That's right.
As we're seeing, certainly with the healthcare team's thesis about investing is those large incumbent, heavily, I don't want to say they're fat, but they definitely have a lot more layers in most industries.
Sure.
Are going to have to adjust, and they're going to have to go more towards an Apple. But the tech space for I think a lot of people argue has really, healthcare demands more tech, more the coding and billing systems and the audit systems and so forth. How do you see that changing, and are we going to talk about that at all?
We are.
Okay.
We are going to talk about that. I
think we have a friend who refers to as value destruction.
Yes, yes, we do. We do have that friend. So we are going to talk about that. So I would say technology has already settled in the healthcare space as it pertains to taking the majority, not all, but the majority of health records and moving them into the cloud and making that part of it digital.
Right.
And we obviously have lots of diagnostic devices, and so, in many ways, the healthcare industry is technology enabled. But there are many ways in which it is not, right? So, so payments is a place where it's still not really technology enabled, right?
Right.
Especially as it pertains to consumer payments, the ability for consumers to manage their own accounts, marketing capabilities, right? I mean,
Right.
it's one of these. This is like baseline things you need if you're going to become a consumer company. You have to have marketing capabilities. The marketing technology is still, I wouldn't say nascent, but it's emerging at best, right? Compared to everything you see in the retail space and the web space, e-commerce, all those types of things.
Oh my gosh, yes. Now, I think it's really interesting that we're including a music component in this, because there isn't, this is Nashville's faced the disruption of music,
yes.
right? And we went from, and I have this friend who's a label. He was a label executive throughout the 1990s, and I remember him telling me, "Yeah, I never imagined a world in which you bought something and couldn't hold it and look at it and read it." So talk a little bit about the disruption of the music industry, which you know a good bit about, and the emerging disruption of the healthcare industry, which most people go, those two things have nothing to do with each other.
Yeah.
But in fact,
they have a lot to do.
They have a lot to do with it. They're very similar paths.
Yeah, they have a lot to do. I mean, I think you want to talk about the heyday of the music industry, right? The heyday of the music industry, most people don't talk about it in these terms, but it had a lot of fat in it. I mean, that was really the bottom line. CDs were marked up at really a ridiculous level, right?
Yeah, like 3,000% or something.
Exactly,
yeah.
and so the fact that they couldn't predict that there was going to be some disruption that would come in and take advantage of sort of their greed,
right,
quite frankly, is just sort of the short-sightedness of having a frothy market. I think in the healthcare space, things aren't that frothy right now. The reimbursement levels are coming down,
right,
but they're also not being distributed quickly to these new modalities, right? I mean, again, still, insurance companies and mostly the government are still who pays for healthcare, right? And so we don't have broad, changes in reimbursement for the health systems to really embrace telemedicine, as an example, right?
That's a good example, yeah.
Right, and so what's happening is you're seeing more early stage companies that are launching with direct-to-consumer telemedicine models, right? Where they're saying, hey, you have these large deductibles, you have this premium, do the math, you can pay me $99 a month and get as many well visits as you want, and you never have to leave the comfort of your home, and we might even drive somebody out to your home, if that's necessary.
Right, yeah, telemedicine in particular, there's actually a bill that just is being marked up on the Senate side that's going to open the doors a little bit wider, but telemedicine it's silly, that your doctor, you want to just talk to him. I'm like, and he can't get paid.
Yeah, that's right.
You just want to, I can come in, sure, but wouldn't it all save us a lot of time and money if I just talk to you?
That's right. That's right.
And that is a disruptive technology, but going back to the music business too, it wasn't just the markup. I think it was, there were gatekeepers, and you could only go this path in order to get
distribution.
The distribution
channels.
Yeah, the parallels between music distribution and pharmaceutical distribution, and the entrance of Amazon will provide some really interesting parallels.
Yes.
I think.
Well, the entrance of Amazon provides, interesting times for everybody. Anytime Amazon gets in anything, just buckle up, right?
Yeah, our Brian McGough, our retail analyst, I wish he was here because he's spent a lot of time on Amazon's disruption of the retail space.
Sure.
And we're watching malls disappear.
Yeah.
We're watching big box retail. Sears. You're like, who thought that would, ever? JCPenney.
Right. Right.
And as Amazon, takes control of this, and really, the thing you pay for, it's going to be distilled down to its value to you and you alone.
That's right. That's right.
With maybe a little bit for everybody else.
That's right.
Which is really interesting. So day 2 and 3 we'll have technology, we'll have music.
Yep.
And then
wellness. We'll have some business stuff as well.
Okay.
And we'll even have some policy in there. I mean, I think days 2 and 3 are going to be broad. By the way, that's when most of the people will be at the conference.
Right.
That's
yes.
the most sort of open part of the conference.
Right. So what kind of, let's talk a little bit about policy. You know that's my favorite topic.
Yeah.
So I know we've talked about some of the state Medicaid directors coming and talking a little bit. That's a real area of change. And what kinds of issues, and I know we're still early in the agenda and getting everybody, but what kinds of issues would you like to see explored and discussed, well, on any day, but certainly days 2 and 3?
Well, I mean, I think there are so many to talk about, right? I mean, you know, we've got the sensibility of AHCA,
right.
and sort of how the Senate is going to respond, manipulate, adjust, send back. I mean, what is going to happen there? So that's a big topic in and of itself. I think one of the things that we're going to have coverage of is Planned Parenthood. So we're going to dig into that because the defunding is becoming more and more real.
Right.
And sort of what that means, not just for provision of health care to women, but really just to the market. I mean,
right.
Are there going to be other providers who can actually make up for the services, that are offered by an organization like that if it is defunded?
And it's funded to the tune of about $500 million a year. I mean, it's significant. It is a substantial sum of money, not to the federal government. $500 million is rounding error to the federal government, but to the organization.
Yes, and then to the people that they serve.
And whether or not somebody would be able to pick up that slack with any speed would be pretty tough.
Right. So I think that's a big one, actually. I mean, I think what is the fallout that would happen from that? Because it's been thinly covered right now.
Do you think we'll have the opportunity to talk at all about rural health policy and those issues?
I mean, I think you have to, right? I mean, I think in a year where we're in the first year of the Trump presidency, and it's clear that the rural communities were a very big part of that, and their voice on the way that the economy has sort of treated those communities and the way that healthcare has sort of gone in those communities, the closing of hospitals, and that's obviously relevant to the Nashville healthcare ecosystem. So I think, we'll have to talk about that.
Yeah, and that's something that I'm hoping that there is a good conversation about, because rural. Sometimes if I lived in rural America, I'd wonder why I paid taxes. You know, because you're not getting a lot of services, and you're not. Rural communities have been the home of a lot of manufacturing, and which is the employment has dropped about 30% since the mid 1990s, I guess. So rural health and rural communities and what that means, because and how those communities will sustain sustain a hospital or sustain a health system that is accessible, it's going to be really tricky in a deflating environment, don't you think?
Absolutely.
Yeah.
Absolutely. Yes. Yeah. I mean, what are, there are lots of solutions, I think, for some of the lighter touch things. Pharmacy, being one. Primary care, well visits, but the hospital, right? I mean, where things really get urgent. The emergency room, acute care, scenarios. What are we going to do?
Yeah, and that's maybe when we'll hopefully talk about the mini hospital, which we're seeing. A lot of conversation and emergence around. Let's get away from that full service
thing,
multi-line hospital in rural Texas or rural Tennessee,
right?
Because that's just not a sustainable.
Pare it down to the thing it needs to be.
Right. And then rely on some larger hospital within a. It's one of the conversations that I hope we're going to have in day 4, which is the investor forum that we're most interested in.
That's right.
Although we're interested in all of it, we're going to be hopefully talking about the future of hospitals and what does that look like?
Yeah.
And who has a role in that? One theory, David Gerard, I know that's involved, is that we're going to go from 5,000 hospitals to 500 health systems.
Seems to be moving that way.
It really does.
We
saw this morning, there was an announcement on just today of IASIS being acquired by Steward Health, and we're going to probably continue to see that.
Yes.
See that happen.
Yes, it's out of necessity, right? I mean, you have to drive administrative and overhead efficiency in these organizations because the margins are just it's simple math.
Well, and in the back to the rural communities, and in the rural communities, that simple math is much tougher than it is in an urban community.
Yes.
So change. And I tell people all this: if you're looking for the future of healthcare, you probably aren't supposed to look in New York City or even Nashville. You're probably supposed to look in Maryville, Tennessee, or Uvalde, Texas.
Yeah, and there's not enough innovation in those communities, right? I mean, I think there is a massive opportunity to innovate around Medicaid.
Oh.
Massive.
Well, that's a great segue because this conference is in August,
yes.
and that means Congress will have recess, and it is generally agreed that the August recess will be a backstop. Congress, if you don't already know, loves to vote and leave town. That's been their MO for many years. But the August recess is considered a backstop for the Senate passing their version of the House bill, the American Health Care Act. So when we have this event in August, we will potentially, I'm not going to say likely,
right.
but potentially,
right.
we could have a bill that we could have the Senate version. We could see more clearly. And Medicaid has been a real area of focus, more for the Senate than the House. Senators generally, they're elected statewide, so they have a lot interest much aligned with governors. Governors also like to run for Senate, so there's a lot of sympathy there. So, so what kinds of I think Medicaid is. I don't think Medicaid's a great program myself, but it's not a bad program. It's not a great program. But what kinds of things do you think we could talk about, since we are still planning some of this, when it comes to Medicaid and Medicaid innovation and in these, particularly in rural communities, but in all communities?
Yeah. Well, I think we need to focus in on where the costs are. Right, where are the costs? And you have very different challenges with Medicaid populations than you do with sort of urban populations that are not qualifying for Medicaid, right? So what we've learned at Health Further through our conversations with managed care organizations in the state of Tennessee is, one of the big issues is just member outreach and communication, like just being able to find them and keep up with them. Right. Okay, like we're not even talking about like the clinical piece of it, right? It's just the
people living in
piece.
Poverty are highly mobile.
Right, they're mobile, and if they do have cell phones, they're on these really sort of limited plans where the data will run out before the end of the month, and sort of all these other challenges. And so you just have dimensions to the challenge that don't exist in other populations that create multiples on the cost. And so I think that we have to have a lot of conversation about the characteristics of the Medicaid population and what are the key things that are driving cost.
Right, and one of the things that Darren Gordon, who was the state Medicaid director for Tennessee, and he was also the president of the National State Medicaid group, he likes to say that only 20% of the services the Medicaid population needs are health care services. Yeah. They need.
It's much broader than that.
Yeah, and you could get that 20% down if you spend a little bit of time on housing, food, nutrition, and so forth.
Yes.
Well, one of the things that I'm hoping to explore too is, the individual market. The individual market was conceived as something that people would move out of the employer market into the Affordable Care Act exchanges, and that's how they would purchase insurance, and everybody would be in the individual market, or the most people would be in the individual market. That never happened.
No.
And in fact, what's in the individual market are people who qualified for Medicaid last year, and they are moving in and out and out. So one of the trends that one of the things we've seen governors talk about is, why can't we just put those two things together? Why can't we make this a little bit more seamless? And why can't we, why do you have to get a different insurance card because you made more money last year? Why can't you just have this, United Health Medicaid managed care or United Health individual market
Right.
with a little bit of subsidies from
Right.
the federal government.
Right. Why? I mean,
Well, one of the things that just shocked me is about the Obamacare and the and I hate that phrase.
yeah, I do too.
The Affordable Care Act.
Yeah.
That's how most people know it.
I know, but it's but that's sort of politics at play, right? I mean I think that's one of those things that does not help the conversation, because a lot of the issues that were present in the Affordable Care Act, and I'm not sort of being on behalf of Obama or against, but
Right.
I mean, one of the big issues obviously was the way that the risk pools were managed, obviously, right? The risk corridors,
Right.
and the reason why they weren't handled correctly was because of partisan politics, right? You know what I mean?
Oh, yeah.
It wasn't in the interest of trying to get
Yeah.
to a plan that could work and that could be functional. And so when you see all these insurance companies bailing out of the exchanges, right, which is making the marketplace less attractive, I don't think that was Obama's thing. I think it was the Affordable Care Act. I mean, I feel the same way about Ryan Care or anything else. I mean, I wish we had better literacy for these bills. That's why I appreciate the work you do so much, right? We're actually focusing on dissecting what's actually in the policy.
Yeah, what's here?
What's really here?
Yeah.
You know.
Well, the reporting on the American Health Care Act and what's going on has been abysmal. There's really no other way to
Yeah.
discuss it. Hyper partisan.
Right.
And a lot of hyperventilating. Not to say it's not important, it is, but there's been a lot kind of silliness going on here. Well, in addition to the text of the bill, and the way that it became law, the Affordable Care Act, one of the things that I think really didn't do it a great service was, scheduling, for example, open enrollment between November 1st and January 31st, the periods of the lowest level of liquidity
Right.
for people
Right.
living in poverty,
Right.
And it's like, okay, yeah, I really, somebody who's they've got everything on layaway for Christmas,
Yeah.
and they're
Yeah.
hoping to get a bonus to
Yeah.
make it all work
Yeah.
out, or
Not
get a
tax
little
return
bit.
season, right?
Yeah, you're not getting your EITC.
Yeah.
And the highest level of liquidity is in February and March, when the earned income tax credit, and you get your return filed, and you get your money back from the government. That's the perfect time to buy
Yeah.
health insurance. And
Yeah.
I always thought, gosh, they really are timing this all wrong for the people that they're trying to address.
Right.
And if they just would slide it, but it really was at odds with the philosophical belief that this was going to be a middle class program, and what it ended up being is a program, for people living near the poverty level,
Yes.
which is fine. I mean, they need that's an important group of people to serve, but for some reason, just couldn't get comfortable with that, which is kind of a failing of policy, among other things. But so let's go to day 4
Yeah.
and focus on that. So
Yes.
day 4 is investor forum, and Hedgeye is going to be
Your
responsible
show.
for we're going to be responsible for a lot of the programming. And I want to make you happy. So what do you think the best outcome is there? What do people walk out of there thinking and knowing, whether they spent the full 4 days there,
Right.
or they
Or
just
they
came
just came for that
for
day.
the investor forum?
Yeah, so that's a great point. I mean, we're going to need to address both groups. If you have been there from the beginning, and some people will have been, your mind should be very much expanded.
Yes.
Yeah, and you should be very open to lots of ideas. But I mean, look, I think what people are going to expect to understand is, how is whatever Senate came up with going to change things?
Right.
I think that's,
assuming they have, we'll see what happens.
That's exactly right. How is that going to change things? How are the health systems going to respond? How are the private insurers and nonprofit insurers going to respond? And I think also, how are the payers and the providers going to continue to relate to each other? I think that's a really interesting dynamic, because we're seeing some verticalization happen on both sides.
Okay, so
of that
we
relationship.
saw Optum acquiring surgical care partners. We saw, let's see, we have seen United Health has
I was about to say United Health,
made some other acquisitions. Then we have a few hospitals that are having somewhat spotty luck getting into the plan business.
Getting into the underwriting business,
right?
Right.
And so
seems a little easier to move from the payer side and just acquire
a provider,
than sort of make that move.
Although we're early in that, so it's hard to know how that's gonna turn out.
Yeah,
right?
That's right. But I mean, I think that what we're seeing is that there is some waste in that relationship, right? You know, that's not targeted at caring for the population efficiently.
Yeah, no question about it. And insurance companies have always reacted to that waste by simply cutting reimbursement. Okay,
Right.
we're just going to pay you less,
Right.
or we're going to deny that service.
Right.
I think is how they've addressed it. And now they can't seem to get much more juice out of that squeeze, so they're going in this other direction. But
I think payment reform is also another interesting one. It doesn't seem to be getting a lot of coverage because, you know, there's so much. I don't know. I feel like there's a lot of denial about the future of value-based care, but
you mean people don't think it's going to happen, or
pundits and you know, and probably some health system leaders are also saying, you know, it's going to continue to be fee for service, and I'm not sort of on either side of the fence about what's right or what's not, but we are seeing certainly from, you know, state Medicaid and Medicare organizations that they are rolling out sort of this episode of care model that is more value-based and is forcing these partnerships to be created,
right,
which gives room for new entrants into the provider market, right, to do things that the health systems don't have the capabilities to do.
Right. So one of the things that I hope we get out of day 4 is is to get people to focus some attention on the things that they might be missing in their investment thesis. So one of the things that I know we have to talk about value-based care, because although the CMS, the aggressive approach they took going into the election with bundled payments, for example, they have really backed off of that because the new secretary just doesn't buy into these mandatory, you know, bundled payment systems.
That's right.
But what you're missing, if you think it's going to be fine, is that there are all these employers who are starting to say, you know, why is our self-insured plan paying for maternity on, you know, an anesthesiologist, an obstetrician?
Yes.
Why not? You know, we've been doing this for a few million years. It's usually turns out the same way. Let's just give you a payment and you figure it out.
Yeah.
You know,
Yeah.
OBGYN. And you're seeing the employers get involved in that. And then, yes, absolutely, the state Medicaid. With the bundled payments, we're seeing, I think there are now 4 states that are exploring, with Tennessee being probably the most aggressive.
Sure, yeah. So these are all the types of trends that I think are going to force providers to change
how they behave.
Right? I mean, so you know, you do have these sort of forcing factors. I agree, the employer piece is a big one.
Well, they're the ones that everybody wants to know, where did why aren't they at the party? You know, because for so long they never really engaged. But you can only raise deductibles so far, right?
Right.
And then you're going to have to start coming up with another answer.
That's right. And there are some really interesting companies, sort of in the unique employer only business, where they're creating these niche networks, sort of much more selective, limited, but much better pricing models for the employers. And so I think that's also interesting, sort of as a competition to the, you know, the mainstay insurance companies. And I think there's a lot of interesting stuff going on out there.
Okay, so also in terms of day 4 and what, you know, we want to walk away from, we'll certainly explore, okay, what happens to hospitals, which has been the backbone of the American healthcare system for the last 50 years. Even though the previous 150 years it was not, it was the physician, the family physician.
That's right.
And it became the hospital. So that moving back to the future, I guess, is where we're headed there. So we talk about that. Talk about the payer role and the changing role of the payer, and we'll certainly talk about Medicaid. What about drugs? What about pharmaceuticals? What do we talk? What is what are we supposed to talk about there? What is going to happen?
It's a hard one.
Isn't it though?
It's a hard one. Yeah, I mean, I don't see many things.
But it comes back to the whole consumer question, right? We wouldn't be talking about the price of these drugs today if it weren't for the fact that more people actually have to pay for them through higher deductibles.
Well, so again, I mean, I think maybe a different take on that same question would be, when is the arrival of the true healthcare consumer coming, right? Because I think
that's a loaded question.
Because that's going to drive those things, right? I mean, we've got transparency engines right now. There just aren't many people using them, but they're already there, right? If you wanted to go online,
what prevents somebody from using them? What's the
awareness?
Okay.
Ownership, responsibility, right?
Right.
It's so much of it is mental, right? So much of it is habit, right? We're still not seeing ourselves as consumers. We're just writing these checks and we're saying, man, my premium's going up. Oh my gosh, my deductible never ends. You know what I mean? Like we're saying these things, but we haven't shifted to the mode of, maybe I should look around and see if I can get these bills down a little bit. Like, what can I do about this? We still feel like we're at the mercy of the system. And so for me, I think one of the big topics is, how does the rise of the millennial, right, now being the largest generation in the labor force, what does that do to the adoption of consumer behavior in the healthcare sector?
Well, unfortunately, we're going to have Neil Howe, the Hedgeye demographer, there to talk about millennials.
Yeah.
He coined the term millennial, and talk about those kinds of behavioral shifts. He's done a ton of work there, so that should be I'm really looking forward to.
Yeah, and that's an attractive segment of the market, right? I mean, really good margins,
right?
Yep. And I think the millennials are going to be really important for us to pay attention to, because they truly are a generation as a whole that believes everything should happen on their phone, everything, right, and everything should happen for them.
I've got three
on delivery.
I've got three of those at home. Yes.
Yes. So right? And so as they shift and they start to take more responsibility and they come off of our, because I've got a couple too, as they come off of our insurance and they have to start taking care of these bills themselves, I think. I think.
So the delay in the being insured under your parents' plan up until 26 has really delayed the impact, the consumer impact of the millennials, which is a fascinating issue. So the bulge, they should be hitting it right about now. Coming off their parents.
I mean, so at Health Further and Jumpstart, we employ a good number of millennials,
right?
And
as we do here at Hedgeye.
Yeah, and so if you look at the employer insurance take rate, you'll know. Like, it hasn't hit yet.
Okay, yeah.
It hasn't hit yet. It's coming.
You're right.
Right? You know what I mean? Once this eats into their happy hours and their, climbing gym memberships and, and their music festival, slush fund.
Well, I'm not very popular in Nashville when I tell people, we really shouldn't have that as policy. That's a terrible policy. We want them to like get
out.
Drive this consumerism.
Yeah.
So that's going to be a fascinating thing to talk about. Well, I know we have a partnership with Life Sciences Tennessee, which has done a ton of work in the biotech, pharma, meditech area, and I hope that we can explore the drug pricing issue. Although it's only about 11% of the spend, and it's only been 11% of the spend, it is a populist issue, which is why the president has gotten so interested in it.
Well, I mean, there's two big issues, right? There's price gouging, and there's the opioid.
Right.
Abuse issue.
Right.
These are two issues that industry has got to resolve.
Right.
And they don't seem too keen to resolve either one. On the whole, at the moment, we're not seeing any leadership that's emerging clearly and taking responsibility for those two things.
Yeah, it's a complicated issue.
It is.
I mean, in fairness to the pharma is the best lobby in Washington, bar none.
Yes.
But they're also, in fairness to them, it is a complicated issue.
It is complicated.
When you start thinking about the distribution chain, back to the music business, and back to buying books on Amazon, the distribution system for drugs in and of itself is contributes dramatically
to the
problem.
To the problem.
To the problem.
I mean, what they will say is we're pretty far away from the actual point when it gets to the patient.
Right.
Right. You know what I mean? And so in between us and them, how can we be responsible?
And not unfair, right?
Yeah. No. And look, I get that, right?
Yeah.
But I think there also has to be some acknowledgement that these are real problems. It's clear they're real problems.
Right.
And while they may be able to feign no responsibility based on that distance, it's not helpful given that they are the producer of the thing that's turned into these really big issues. And so that we need their voice, we need their brains, we need their ideas on how we can fix the problem in a much more engaged way than we're getting today.
Right. So also in day 4, we're I hope that we can talk about the disruptors. Who's coming up.
Yeah. We'll definitely talk about that.
Yeah. So publicly traded companies are sort of by definition not disruptors. Disruption is not necessarily what they're, unless we're talking about Amazon.
Yeah, I was about to say, in the healthcare space, potentially
yes, let me clarify. In the healthcare space.
Yeah, but certainly the Amazons and Alphabets and Facebooks and
right,
those companies are definitely disruptors.
But we don't have in the healthcare space a ton of disruptors. Teladoc,
not publicly traded, I would say.
Yeah,
no.
we have a few here and there, but we want to talk about disruptors, whether they're publicly traded like a Teladoc,
right,
or Exact Sciences, which has this Cologuard treatment we've done a lot of work on. What other types of disruptors do you see as adding value to that day?
Well, one of the things I'm excited about Investor Day is that Hedgeye is going to really bring sort of that solid viewpoint of the public markets, and then we're also going to be bringing in private equity, right?
Right.
And so we're going to have growth stage companies, venture companies, and really a lot of the disruption is in that space. It's on the private markets, it's emerging, but you've got companies that some are taken in at billion-dollar market caps and so valuations, rather than the private markets. But it's a lot of the stuff that we need to be talking about that is on the horizon for the public market is in the private market.
And that is what I think is going to be extremely interesting to investors in the public markets, because they want to know where the threat is to their public investments, or the complements, not just the threats.
Yes.
A lot of these things will actually
exactly.
add value.
And I think we can show companies that are well on the path to acquisition or having phenomenal growth rates or really sort of growing in the number of lives they have under management. And there are some very, very interesting models that have not yet hit the public market at all, that are this sort of full vertical stack of I'm a payer, I'm a provider, I'm heavily technology leveraged, I have some direct-to-consumer aspect to it, right? And I can take full advantage of, consumer pay all the way through to like Medicare Advantage or something like that, right?
Okay,
So you've got these companies that have really sort of looked at the whole value network proposition and just sort of reimagined it, reapproached it, and are growing and raising hundreds of millions of dollars. And we need to talk about those companies.
We do need to talk about and hopefully maybe we could get one of them to show up and talk about how they envision the future. So kind of bringing it back full circle to the day. What do you hope people leave with, other than a really great time in Nashville? Because it's a really fun city. And we have that solar eclipse the first day, the day before.
That's right.
Come for the eclipse, stay for the healthcare.
Exactly.
As we would say. What do you how do you want people to leave the event? What do you want them to have thought about? Obviously, we'll want them to come back next year and do.
Look, I want them to know about the breadth of activity that's happening in healthcare, and I think it's hard to get a good view on the breadth of activity in any one place. So I think that's one thing we'll be able to accomplish because we've brought all these key players in: the healthcare technology, the life sciences, early stage innovation, public markets. I think politicians, bringing all of them into the room to have sort of these very unique conversations, I think will give people a much more comprehensive view. I think that's important. I think also, you ought to be able to start to develop the next iteration of your investment thesis for the next 12 months. I mean, that's my hope is you know, if you're coming. And then the third thing would be, you know, if you have any interest in the private markets, there are going to be a lot of really great companies who will actually be there. You know,
I bet.
And so, you know, whether it's for the purpose of investing or for just tracking those companies, there'll be lots of people there that will be happy to meet with you and you know, start to build a relationship now. So as they grow to your stage of, you know, where you invest, you can have that relationship.
Yeah, no, that's we hear that all the time.
Yeah.
That is immensely valuable,
Yeah.
and we as analysts find it immensely valuable. You know, with the regulatory environment in which public companies have to operate, it makes it really only enhances their it keeps them from innovating.
Yeah.
Because they can't really talk about those things, and those things don't necessarily add value to them. Whereas private companies, you know, aren't encumbered with that sort of thing. So I think it's going to be a great event. We're thrilled
We're excited
to be involved, and it's going to be a fun summer just getting it planned and worked out.
Yeah, absolutely. So yeah, we're super excited to be working with you on it.
Okay. So before we turn it over to Josie, do you is there anything I didn't ask you that you wanted to say?
No, I mean I think I'd just sort of make sure people go to healthfurther.com.
Oh, okay. All right. Let's do that.
Okay. All
right. So if people want more information about the event and the schedule and who the speakers are.
Sure.
Why don't you?
All that information is at healthfurther.com. Okay. You can sign up for our email address right on the site, and for our email list right on the site, and then you'll get notifications as we roll out new announcements. And we're sending those out about twice a week. Purchase tickets there, obviously.
Right.
Earlier you buy, less you spend. And you can follow us on Twitter at healthfurther, Facebook, LinkedIn, the whole deal.
And if you're a Hedgeye customer, hit sales@hedgeye.com, and they can help you with any questions or any interest you have in the event. So, all right,
Great.
Marcus, thanks so much.
Emily, thank you.
Enjoyed having you.
Pleasure.